At the Monday trial of former Mount Carmel anesthesiologist William Husel, Vanderbilt doctor Wesley Ely took the stand and described in painstaking detail how he believed huge doses of painkillers took the lives of 14 of Husel's patients.
What ultimately ended up happening with Mr. Allen, Dr. Ely?
What happened was that on the evening of May 28th, his code status was changed to DNR. And he was given 1,000 micrograms of fentanyl, 6 milligrams of midazolam, and that ended his life. In fact, 20 minutes later.
And this was again given in the procedure of palliative extubation?
Yes, but it doesn't meet any of the criteria for palliative extubation. The patient did not have elevated pain scores. He did not appear to be suffering. He was actually tolerating things to the degree that we could let his life go on and have its natural course, but it was ended in 20 minutes by these lethal doses of fentanyl and midazolam.
And based upon a reasonable degree of medical certainty, your expertise, what did those medications do to Mr. Allen?
I think they killed him.
And did you draw a conclusion based to a reasonable degree of medical certainty as to what effect the medication administered to Danny Millett had on Mr. Millett?
I think those medications ended his life, killed him. Right, so she's already got this big bleed in her brain. We know that's severe. What we want to allow her life to do is to take its natural dying process, which could be that she could wake up in a couple of days and have some interactions with her loved ones. That can absolutely happen. Even if that doesn't happen, remember that my job is to allow her life to take whatever its natural course is and allow the candle to burn out on its own. But what the medicines did was they blew the candle out, stopped her from breathing, and killed her.
And is that based upon a reasonable degree of medical certainty?
Yes.
But during afternoon testimony, defense attorney Diane Menashe tried to cite it was compassion and comfort care that Dr. Husel was providing.
Allison, 4 heart attacks and prolonged CPR. Would you agree with me?
Yes.
And cardiogenic shock, which required the vasopressors.
Yes.
And acute respiratory failure, which required the mechanical vent.
Yes.
Correct? Kidney failure, liver failure, endocrine failure.
Right.
He had severe metabolic acidosis that was not compatible with life. His pH was a 6.53. Would you agree with me?
Yes.
He had cellulitis of the leg, suspected pulmonary hemorrhage, correct?
Yes.
And then he had the suspected GI bleed. It's Troy Allison.
Yes.
And yet on your direct exam, you testified, and I quote, "Let's keep him going." Remember saying that?
My point is to allow his natural dying process to occur, and I agree with the family's decision to support him and remove the life support. That's it. The decision to remove life support does not equate to determining death by giving drugs. There's a very important distinction there. So I support the family, I support the chaplain's note, and that family never asked for him to receive a lethal dose of medication.